My name is Rojana Batusami and my matrix number A194910.
My name is Amira Nazia Mikizalilo and my matric number is A195039.
My name is Nofariza Adawiyah binti Sahad Elaya Sahad and my matric number is A195363.
My name is Nuria Asimaliana, number matric A195664.
My name is Nur Shazlin binti Zamzuri. My matrix number is A196277.
For introduction part, Malaysia is experiencing demographic changes by declining fertility rates and increasing life expectancy. From 1990 to 2020, the elderly people doubled, while fertility rates dropped below the replacement level. It caused an imbalance in age structure planning in long-term financial risk management, such as pension sustainability and healthcare needs. Contribution to these trends globally, because urbanization, higher living costs, and improved healthcare. Actuaries must adapt by providing tailored retirement planning and supporting policy development based on population projections. Move on to the discussion part. First and foremost, fertility decline. Fertility rates have dropped by 50% globally over the last 70 years, influenced by socioeconomic, educational, lifestyle, and psychological factors. It's declined from 6 children per woman in the 1960s to 1.7 in 2023. The demographic shift is faster compared to neighboring countries such as Japan, Indonesia, and so on. Second, rising life expectancy. It's driven by medical advances, improved healthcare access, and healthier lifestyles. Better education, healthcare infrastructure, and living standards support longevity. Third, aging population consequences, such as aging society, reduced workforce, higher healthcare costs, and higher pension costs. Last but not least, economic and actuarial impact. Smaller working population burdens the pension system. Second, risk of economic slowdown if pension systems and actuarial planning are not adjusted. Last, need for sustainable policy reforms to manage long-term financial and demographic risks.
Let's begin by looking at the factors contributing to low fertility in Malaysia. There are three main drivers behind this decline. The first is socioeconomic and educational pressure. As more women pursue higher education and careers, many of them delay marriage and childbirth. In urban areas like Kuala Lumpur, couples often face high living costs, job insecurity, and limited access to childcare. These factors create financial and emotional strain, making it harder to start a family. Without strong family support policies or flexible work arrangement, many women feel discouraged from balancing work and parenthood. Second factor is lifestyle and health. Urban living encourages sedentary habits and poor diets, which increase the risk of weight-related fertility issues. Obesity can affect hormone levels, reduce egg quality, and lower the success rate of fertility treatments like IVF. As more women delay childbirth into their 30s, these health risks become more serious and directly impact fertility outcomes. The third factor is mental health and stress. Many young women today experience chronic stress from trying to manage work, education, and future family plans. This stress can disrupt reproductive hormones and lead to irregular menstrual cycles. At the same time, poor sleep, irregular meals, and emotional exhaustion can further reduce fertility, yet mental health remains a largely overlooked factor in reproductive care.
Impacts contributing to low fertility. Low fertility is a growing issue, especially in countries where people live longer but fewer children are born. This creates a demographic imbalance that affects the future workforce and economy. It's not just one reason, it's a combination of social, economic, and personal factors that influence people's decision to have children. First, socio-economic and educational pressure. Women today are more educated and active in the workforce. This is a good thing, but it also means many delay marriage and childbirth. In a city like Kuala Lumpur, the high cost of living and lack of childcare make it harder for couples to raise children. 2. Obesity, metabolic and lifestyle factors. Obesity affects hormones and makes it harder to get pregnant. Inactive lifestyle and poor diets, especially in cities, make this problem worse and increase health risk for both mother and babies. 3. Mental health, psychology, stress and culture norms. Why many women today feel stressed trying to balance work, personal goals and family. Stress can directly affect fertility. Also, modern culture focuses more on personal success and freedom, leading to delayed family planning. Without supportive policies, people are less likely to have bigger families.
Next, factors contributing to high life expectancy. First is education and socioeconomic status. People with higher education tend to live longer because they adopt healthier lifestyle, access better healthcare, and enjoy higher income stability. Education influences everything from nutrition choices to health awareness, leading to better long-term outcomes. Second is strong public healthcare system. Universal health coverage has made services like vaccination, maternal and chronic disease treatment widely available. Community clinics and public hospitals ensure that even rural populations receive basic healthcare, which helps reduce preventable deaths and extends life expectancy. Third, traditional dietary habits also play a role. Many older Malaysians still consume balanced home-cooked meals rich in vegetables, fish, and herbs like turmeric and ginger. This diet reduces inflammation and prevent chronic disease, supporting healthier and longer life. Compared to fast food, home meals also allow better control over ingredients and nutrition.
Impacts contributing to high life expectancy. Now let's look at why people are living longer. This is usually seen as a positive sign of development, but it also brings important challenges, especially for patient and healthcare system. High life expectancy shows success in areas like healthcare, education, and income, but it also means we need to prepare for an older population that may need more support. First, education and socio-economic determinants. People who are more educated usually live longer because they understand how to stay healthy. Higher income also helps people access better food, housing, and healthcare, but longer life means more financial support is needed in retirement. 2. Public health infrastructure and healthcare access. Public healthcare programs like universal health coverage help people live longer, but this also leads to more chronic illness and higher healthcare costs, especially for older adults. 3. Nutrition and dietary habits. Healthy eating, like diet enriched vegetable and fruits, reduce disease and support brain health. As people live longer, diet become even more important. Actuaries need to include these changes in their model to plan for long-term care and financial support.
Now we're going to take a look at the approaches taken for the issue. Firstly, the individual have initiative to have a child through medical support like IVF. However, IVF costs a lot of money depending on the treatment. Therefore, the individual must have better financial planning other than taking care of their body with healthy diet. With that, they know how much the money they use for daily life, saving and emergency. This can lead to financial stability which can help family planning. Furthermore, choosing to pursue higher education and technical training can enable individuals to enjoy a higher income because they can demand the higher income with their certificate. They have quality, and this financial stability make it easier for them to raise children. Next, company also contribute to this issue by supporting the government approaches, which is creating supportive workplace environment. This include parental leave, flexible hours, financial incentive, and healthcare coverage for their employees. Furthermore, company can reduce production costs through automation and process innovations. This helps to keep their product affordable while retaining profits. This in turn is financial pressure for growing families. Lastly, the government role is very crucial, which is the government can introduce new policy like pro-natalist policy, which is an incentive which encourages couple to have more children. For example, it gives subsidies, flexible employment policy, extending maternity leave, and financial incentive for children can ease the financial burden on families. Besides, this can help actually to create insurance for the family with better planning. The government also can control inflation to avoid financial problem for young people. With the affordable price in the market, young couple will have less burden to build a family. Furthermore, by investing in healthcare, education, and social programs, the government help foster a stable, sustainable population. This, in the long run, strengthen actuarial model and financial stability for everyone. All in all, when individual companies and the government collaborate, we can create a supportive framework for growing family. This guarantee financial stability, help manage future financial risks, and maintain a strong and healthy population for the future.
I want to talk about actual knowledge related to demographic changes, especially for fertility rates, and how they affect actuarial work. As fertility rates drop and population get older, actuaries now have an important role in predicting and helping societies plan for the future. The Lee-Carter model is so important here because it was first used to predict mortality rates. But now it's also used to predict fertility rates. By looking at age and time, the model helps actuaries better predict future birth rates and population changes. Next, declining fertility rates. When fertility rates fall below 2.1 children per woman, their population starts to get older. So this puts a lot of pressure on pension system, healthcare and social service because there will be fewer young people to support the older generation. Last but not least, impact on actual planning. A smaller workforce in the future means there will be a fewer people paying into pension and healthcare system. Actuaries use birth trends to predict future costs and make sure pension funds and social services can keep on in the long run. So to sum up, lower birth rates and aging population bring challenges for actuaries. By using models like Lee-Carter, actuaries can predict these changes and help plan for future financial needs. So understanding these trends is so important for long-term planning. So now let's talk about some recommendations to address this issue, which is low fertility and aging population. So the first one is pension system need to be reformed. So we can raise the retirement age and switch to national defined contribution system. So it will help to reduce pension costs by having people work longer and contribute more. So next, we need to raise public awareness. By government should run educational programs to help people understand the impacts of low fertility and aging population. So family-friendly policies like paid parental leave can encourage people to have more children. So another key recommendation is to change the immigration policies. By allowing more qualified immigrants into country can help to stabilize the workforce and fill the skill gaps. So insurance companies can play a big role here, which is they should create new insurance product that can combine health and long-term care. These products will help to meet the needs of aging population. And the last one is we must focus on gender equality. Okay. So by ensuring equal opportunities for women in education and work can help to raise fertility rates. Supporting shared parental leave will also help the families balance work and home life.
To conclude, Malaysia's declining fertility and rising expectancy present a dual challenge to actuarial planning. While longer lifespans reflect social progress, the shrinking young population threatens the sustainability of pensions and healthcare systems. Addressing this demographic imbalance requires coordinated efforts in policy reform, economic planning, and actuarial innovation to ensure long-term financial and social stability. Thank you.